my name is Brendan Martins. I'm the lead hand with facilities maintenance and engineering. I look after the trades specifically. Our priority is to maintain the infrastructure and building equipment on site. That's to mitigate the impacts to patient care. A bit of the other careers that we see within AHS that people might not know about, we have a variety of different careers. So the first one being an Indigenous liaison. A lot of the people don't know that we have that type of support structure here. Many people don't know that we have a full projects team that looks after new building infrastructure and renovations. We have a trades team. They're unaware that we have a full trades complement, maintenance team, and power engineering structure. And then some of the more oddball ones would be graphic designers. Some of our larger facilities have lifeguards to accommodate the pools. I've lived in both a small town and large city centers like Edmonton. Grande Prairie is really that blend between a small town feel and it contains large city amenities. What I like about it is we have a tremendous community support structure. So as an example, over the past couple of years, we've had clubs like the Rotary Club and Greg's Distributors hold fundraisers. Just as an example, they've raised over $50,000 to support new dialysis equipment for our ICU at the Queen Elizabeth II Hospital, as well as ultrasound equipment for the QE2 as well. The first thing I'd get you to ask yourself is, what is your 5 to 10 year plan? AHS is the largest employer in Alberta with 100,000 employees and over 1,000 different job titles. It provides you with a tremendous amount of flexibility. If we ever see yourself transitioning into another job title or anywhere else in the region. It ties in with my next point, is that if you do see yourself going to another city or town, we do offer that ability for transfers when applicable and new job applications. So if you're an electrician in Grande Prairie and you decided to uproot your life to move to Edmonton, AHS can support you on that journey. The other avenue that most don't realize is we have a tremendous amount of entry-level positions for those that might not have had an opportunity or a chance to pursue post-secondary education with opportunities for growth. Every department that I've ever had an opportunity to talk to has identified that they're willing to work with their staff members and pursuing what they hope to achieve in the future. And lastly, that you get a tremendous sense of satisfaction knowing that you're positively contributing to the healthcare system, helping the patients of Alberta. So the work-life balance has allowed me to continue my cultural practices of smudging. I'd like to actually spin this a little bit and I guess identify a story that I recently had with a family member. So they identified that they were sun dancers, spoken with them multiple times. It's a pretty taxing experience both on their body and mind. Typically they've found troubles with taking time off after that because it can be taxing and they're not quite ready to go back to work. So what I have identified with them is that AHS can support them on their cultural journeys by offering them items that we don't really share on our job postings, such as personal days, float days, vacation days. This allows you that freedom to book time off to enjoy your cultural experience.